Imagine a surgical operation so profound, so shocking, it actually made a man sing within 24 hours.
Yeah, a procedure that back in 1843 really shook everything the medical world thought it knew about pain, about
It's
consciousness.
about truth itself, even.
Definitely.
Today, we're taking a deep dive into this really extraordinary document from 1843. It's called Surgical Operations Without Pain in the Mesmeric State, and it's by the physician John Elliotson.
And it wasn't just, a dry medical report. It was basically a challenge, a battle cry almost.
Right. From a man totally convinced he'd found this secret to relieving suffering through mesmerism, what we now sort of call hypnosis.
So our mission today is to unpack all of that. We'll look at the amazing case study, the really fierce backlash it caused.
From some very big names in medicine at the time.
Exactly. And what it all tells us about, well, how science sometimes moves forward, the whole skepticism versus belief thing.
Get ready for some surprising facts, some real aha moments, and yeah, quite a bit of historical drama. So let's dive in. Let's start with the patient himself, James Womble.
Okay, James Womble. He was 42, a laborer, and he'd been suffering for nearly 5 years with this awful ulcerated left knee.
How bad was it?
The description is excruciating agony. Apparently, he hadn't slept more than 2 hours and 70 during the 3 weeks just before this.
Oh.
Yeah, his leg was so sensitive he couldn't stand even the lightest sheet on it, and the pain meant he could only sit bolt upright in bed, just desperate.
Truly desperate. And this is where mesmerism comes in, introduced by a barrister named W. Topham.
That's right. September 9th, 1842, Topham starts mesmerizing him.
And did it work straight away?
Well, the very first session, 35 minutes, only his eyelids closed. That was it.
Okay.
But get this, by the third session, just 2 days later, he was, quote, sleeping like an infant.
That quickly.
Yeah. And they found that pinching his arms, even pinching the diseased leg itself, produced zero sensation.
Incredible.
And that night, he slept for 7 hours straight, which for him must have been unbelievable.
Absolutely life-changing. But it wasn't just the pain and sleep, was it? There were wider health benefits.
Oh, definitely. After about 10 or 12 days of regular mesmerism, they saw this great change in him. The hue of health returned.
So he looked better.
Looked better, became cheerful, felt much stronger, his appetite came back. Even his surgeon, W. Squire Ward, who'd been away, he came back and was just astonished and delighted at the improvement, said he looked so much healthier.
So Womble's much better, healthier, sleeping. The stage is set for the amputation. October 1st, 1842.
Right.
Now, you'd think, given he's in this deep mesmeric state, moving him would be easy.
Right.
But no.
No, and this detail is amazing. It really shows how bad the original pain was. Even though he was mesmerized, just trying to move him from his bed to the operating table caused so much pain.
He woke him up.
It woke him right up out of the mesmeric coma. So they actually had to lift his entire low bed onto a temporary platform to do the surgery.
Wow, okay. And during the actual operation, how did Topham keep him under?
He kept his fingers just gently touching Womble's closed eyelids the whole time.
Why the eyelids?
They believed the eyes were kind of the main channels for mesmerism. The most ready receivers and transmitters was the phrase. So keeping contact there deepened the trance.
Got it. And then the surgery itself. Mr. Ward starts cutting.
Yes, he slowly plunged his knife into the center of the outside of the thigh, directly to the bone. The description says the only sound was Womble's calm breathing.
Just breathing calmly.
Even when Ward had to make the second incision in 3 stages because the leg was in an awkward spot, which they noted was actually more painful than usual.
Womble stayed completely out.
Absolutely. His sleep continued as profound as ever. His face was placid, calm.
No flinching. No twitching.
Nothing. Perfect stillness and repose. Not a muscle was seen to twitch. The whole thing, cutting, sawing the bone, tying arteries, bandages, took over 20 minutes.
20 minutes.
Then she just lay there, like a statue.
Now, I read there was some low moaning towards the end, during the artery tying and bandaging.
Yes, Elliotson mentions that. But he was convinced it was just from a disturbed dream, probably related to Womble's anxiety about the operation beforehand.
And the key point.
The key point is that the moaning didn't get worse when Mr. Ward deliberately poked the cut end of the sciatic nerve twice. Pretty roughly, apparently.
Normally, that would cause
Intense shooting pain. A strong dart of tic douloureux, Elliotson called it. But Womble showed no reaction to that specific stimulus. Zero.
Okay, that's compelling. So what happened when he finally woke up? Did he remember the surgery?
He woke up slowly, calmly, seemed a bit lost and bewildered initially.
And in first words.
I bless the Lord to find it's all over.
Wow.
And when they asked him what he felt, he said, and this is the key quote, I never knew anything more and never felt any pain at all. I once felt as if I heard a kind of crunching.
Crunching?
Yeah, but he immediately said the crunching wasn't painful at all. Elliotson reckoned he must have just vaguely heard the bone sawing.
And his recovery afterwards. That sounds just as remarkable.
It really was, astonishingly fast and smooth. 2 days later, they dressed the wound again while he was mesmerized. He didn't even know they were doing it. No pain.
And the singing?
Yeah, singing within 24 hours of having his leg amputated.
It's hard to believe.
And sitting up for dinner in 3 weeks. Totally free from all the usual post-op trauma and nervous excitement. Just an incredible outcome.
Okay, so we have this apparently undeniable success. Pain-free amputation, amazing recovery. How did the very prestigious Royal Medical and Chirurgical Society of London react when they heard about it?
Well, not well. The backlash was instant and pretty vicious.
Immediately.
Oh, yeah. As soon as the paper by Topham and Ward was read, a surgeon named Mr. Coulson stood up and said it ought never to have been read.
On what grounds?
He claimed not showing pain was common and that Womble had been trained to it.
Trained?
Yeah.
But hadn't Womble been in agony just weeks before?
Exactly. And Coulson even admitted he'd never seen a mesmeric fact and knew nothing about mesmerism.
So he was just dismissing it out of hand?
Pretty much. Elliotson points out how Coulson just ignored the huge improvements in Womble's health before the operation, too.
It sounds like pure prejudice. Was there any attempt at a scientific counterargument, even a flawed one?
Well, you had Dr. Moore demanding, get this, affidavits before the Lord Mayor to prove it wasn't faked. Apparently, people just laughed at that.
Affidavits?
Yes.
Seriously?
Yep. And then some younger surgeons, Mr. Blake and Mr. Alcock, just flat out said the man was shamming, faking it. They claimed they'd seen people handle operations without showing pain before.
Right, the stoicism argument.
Yeah.
How did Elliotson tackle that? Because Womble wasn't just quiet, he was completely limp. Right?
Precisely. Elliotson hit back hard. He drew on his own huge experience at St. Thomas's and Guy's hospitals, saying he'd never seen anything like Womble's apparent total indifference.
He gave examples.
Yeah, vivid ones, like the Marquess of Anglesey, silent during his amputation, but gripping his brother officer's hand so hard.
Showing intense effort.
Right. Or a sailor biting his lip. Or even convicts taking thousands of lashes. They might tense their shoulders or bite down on something. There is always some sign of struggle or immense willpower.
But Womble?
Womble showed perfect motionlessness and universal relaxation, a perfect placidity of countenance, no sign of effort at all. Big difference.
Okay, that makes sense. Then there was Dr. Marshall Hall and his reflex motion idea. That sounds more scientific.
It did sound scientific, yes. Dr. Hall dismissed mesmerism as trumpery, basically, rubbish. He argued Womble's case proved too much.
How so?
His logic was, in animals that are unconscious, like after decapitation, if you injure one leg, both legs contract because of reflex actions, these automatic nerve responses.
Okay.
So Hall said if Womble's amputation was real and he was truly insensible, his other healthy leg should have twitched or contracted involuntarily, since it didn't.
He must be faking. An imposter.
Exactly. That was Hall's big argument. Womble was consciously suppressing any movement, therefore faking the insensibility.
That sounds quite clever, actually. How did Elliotson deal with that?
Oh, Elliotson demolished it brilliantly. He turned Hall's own research against him. Wow. He pointed to Dr. Hall's own published experiments on headless frogs and rabbits. In Hall's own studies, sometimes only the limb that was stimulated moved, and sometimes neither limb moved.
So Hall's invariable rule wasn't invariable at all?
Not according to his own data. Elliotson basically said, provoking frogs. Why didn't you contract your other leg? Imposters. You proved too much for Dr. Marshall Hall.
Ouch.
Yeah. He argued mesmeric insensibility could be localized, affecting only certain parts, just like numbness from cold or drugs could be localized. It completely undercut Hall's premise.
Okay, so Hall's argument falls apart, but the attacks kept coming. Sir Benjamin Brodie, another big name.
Yes, Sir Benjamin Brodie weighed in too. First, he suggested maybe Womble was just one of those rare people not susceptible of pain.
Which completely ignored his history of agony.
Exactly. Then he mentioned some hernia operation he did where the patient did feel pain when a nerve was touched, trying to contrast it with Womble's sciatic nerve test. Kind of irrelevant, really.
But his main attack was comparing Womble to someone else.
Right. This was his big play. He brought up a case from 1706, a man named Samuel Chilton, who supposedly pretended to sleep for weeks or months. Brodie implied Womble was just another imposture like Chilton.
And the audience bought it.
Hook, line, and sinker. Apparently, the room roared with laughter. They just accepted Brodie's version based on his authority.
So how did Elliotson counter that? Did he have information on this Chilton case?
He did, and he showed that Brodie had given a totally false coloring to the whole thing. Elliotson produced the original 1694 Royal Society report by Dr. William Oliver about Chilton.
And what did the original report say?
It described Chilton as having genuine sleep-waking episodes, not pretending. One lasted 17 weeks, and during these, they subjected him to incredible stimuli.
Like what?
Sticking a large pin down to the bone, pouring fiery ammonia spirit up his nose, giving him hellebore powder, even dropping him so his head hit a stone when moving him.
And he didn't react.
No sign of sensation at all. He ate, he evacuated waste, but had no memory of anything when he woke up. Dr. Oliver, the original reporter, explicitly concluded it was no cheat.
So Brodie's example actually supported the idea of genuine altered states of consciousness and insensibility.
Precisely. Elliotson called it a beautifully genuine case, completely turning Brodie's attack on its head again.
This is relentless. After all these counter-arguments, what did the society do? Did they reconsider?
Quite the opposite. Their final move was basically to try and erase it from history.
How?
Well, after that first hostile meeting, Topham, the mesmerist, understandably withdrew the paper. But at the next society meeting, Dr. Copland proposed that the minutes of the previous meeting shouldn't even be confirmed.
Why not?
He argued the paper was unworthy and that the authors had broken faith by publishing it elsewhere after withdrawing it.
Okay, procedural arguments. But then Copland said something truly extraordinary, didn't he?
He did. It's quite famous, or infamous. He claimed that even if the story of no painer was true, the fact was unworthy of their consideration because pain is a wise provision of nature, and patients ought to suffer pain while their surgeon is operating. They are all the better for it and recover better.
Seriously. Pain is good for you during surgery.
That's what he said. Elliotson just called it folly, pure and simple, dismissing evidence because you think pain is somehow beneficial.
Unbelievable. And they tried to silence someone who wanted to defend Topham.
Yes, a Mr. Wood, who was there as a visitor, tried to explain why Topham published elsewhere, but he was shut down by Mr. Caesar Hawkins because he wasn't a member. Elliotson was disgusted, called it unworthy conduct.
So what was the end result for Elliotson and the society?
Elliotson had had enough. He felt the whole thing showed perverse prejudice instead of a scientific spirit, and the lack of common justice was too disgusting.
So he quit.
He resigned. He, who had been a long-standing member, who'd even helped get the society its royal title, he walked away. The society then voted not to confirm the minutes, trying to bury the Womble case.
But it was too late.
Too late. The newspapers had already reported it, the story was out there, but it shows the incredible lengths the establishment went to resist this.
It really does. Now, this Womble case was huge, but it wasn't the only evidence Elliotson presented, was it? He had a whole list of other cases.
Oh, absolutely. This wasn't a one-off miracle. Years before Womble, back in 1837, there was Elizabeth Oakey.
What happened with her?
Elliotson describes a seton that's like a thread they insert under the skin for drainage being put into her neck while she was mesmerized. No sensation.
And other things.
Yeah, she could apparently handle red-hot coals without pain, didn't feel cupping or blistering, but all the while she could be chattering wittily and deliriously. She has a strange mix of awareness and insensibility.
Fascinating. And the dental examples are quite striking, too.
Very much so. There was Master Salmon, a boy whose epilepsy was apparently cured by mesmerism. They dressed an eruption on his head daily without pain after he was mesmerized.
And tooth extractions?
Lots of those. A young woman, also with epilepsy, had a firmly rooted three-fanged molar pulled without her knowing. She only complained about the taste of blood afterwards.
Wow.
Another case from Paris, a man named Chenal had a broken molar out. His pulse actually dropped during the extraction, then went up after he woke up and learned what had happened.
Suggesting a real physiological effect, not just pretending.
Exactly. Then a young lady on the Isle of Wight had 2 teeth out. One even got crushed by the instrument. Not a groan. Afterwards, she just laughed at how different she looked.
Laughing after tooth extraction.
Seems so. And a practitioner named Mr. Prideaux took out 11 teeth and 11 stumps from one patient over several sessions. Sometimes they'd chat through it, other times totally unaware, then thrilled to be pain-free.
It's quite a catalog. Any other types of surgery you mentioned?
Yep. A boy had a large abscess behind his ear, open no feeling, mesmerized in 5 minutes. A woman had a large wart cut off her hand. She watched it happen but felt nothing.
Watching but not feeling.
Mm-hmm. A 17-year-old girl had tendons in her knee divided, no sign of feeling, only noticed blood spots on the sheet later.
And there was a case in Jamaica.
Right. A lady had a growth removed from her eyelid or brow. She apparently sang a favorite song while the wound was being dressed afterwards.
Singing again. And Mrs. Gregory's case sounds particularly complex. Jaw surgery.
Yes, extensive work on her jaw and gums, even filing down diseased bone without the slightest feeling.
And the connection with her mesmerist was strange.
Very. When her mesmerist ate or drank, she apparently experienced the sensations of chewing and swallowing and could even taste what he was having, even though she wasn't eating.
That's very weird. But shows a deep connection, perhaps.
Or at least a very unusual state. But maybe the most famous case, even beyond Elliotson's circle, was Madame Plantine in Paris, 1829.
The breast amputation.
Yes, performed by a respected surgeon, M. Jules Cloquet. Cancerous breast and lymph nodes removed.
And her state during the operation.
Profound insensibility. She spoke calmly, gave absolutely no sign of pain, no movement, no change in breathing or voice, not even a change in her pulse.
And she talked to the surgeon during it.
Apparently conversed calmly throughout the 10-12-minute operation.
That just defies belief for that era. How did Elliotson counter the inevitable claims that she must have been faking it?
Well, one key piece of evidence was the selective sensation. Afterwards, during the wound dressing, she felt the sponge tickling her.
Tickling.
Yes, she said, "Come, leave off, don't tickle me," and left. It shows she wasn't just totally numb or pretending to be unconscious. Feeling ticklish but not surgical pain is hard to fake.
That's a very good point.
And Elliotson strongly refuted rumors that she later confessed to cheating. He presented evidence she was wealthy, deeply religious, unlikely to collude in a hoax, and died weeks later from pleurisy, completely unrelated to the surgery itself.
And the surgeon, Cloquet, what did he say later?
When asked if he'd ever seen anyone else bear pain so stoically, he emphatically said, "Jamais, jamais, jamais. Never, never, never." Highlighting how unique her mesmeric state was.
So it really wasn't this simple all-or-nothing state, was it? You weren't just on or off.
Exactly right. That's a crucial takeaway. These cases show a real paradox of sensation. Patients could be incredibly sensitive to temperature, for instance, even in parts of the body that were totally insensitive to being cut or pinched. They could hear, they could talk, yet feel no surgical pain. It was complex, partial, selective.
Which makes the simple "they're faking" argument look even weaker.
Much weaker. It shows the opponents often had a very simplistic black and white view that just didn't match the reported phenomena.
So pulling back to the bigger picture here, what does this whole episode, this clash, really tell us about science and how it progresses or doesn't?
Well, Elliotson himself gets quite passionate about this. He talks about the daily, hourly sin of having strong opinions on things you haven't actually investigated.
The sin of presumption.
Exactly. He argues that this kind of ignorance, especially when held by people in authority, like doctors then, leads directly to injustice and cruelty.
It wasn't just skepticism, was it? It felt almost ideological.
I think that's fair. There seemed to be this deep resistance to something that fundamentally challenged their understanding of pain, especially before anesthesia existed. Pain was just seen as inevitable, maybe even necessary, as Dr. Copland suggested. It was about their whole worldview.
And this kind of resistance, it's not unique in the history of science, is it?
Not at all. Elliotson himself points this out. He draws direct lines to how William Harvey was attacked for discovering blood circulation.
Lost his medical practice over it.
Right. And Galileo, with his telescope, people preferred to argue philosophically rather than just look. And Elliotson mentions the fierce opposition to smallpox inoculation and later vaccination, too. New, disruptive ideas often face a rough ride.
But it wasn't everyone against mesmerism, right? There were some respected figures who saw something real there.
Definitely. Elliotson quotes people like Cuvier, the famous anatomist, who said the effects were real and wholly independent of the imagination.
Okay.
And Laplace, the great mathematician, said the sheer amount of consistent testimony from credible people across different countries meant he just couldn't deny it.
So educated people were looking at the evidence.
Yes, and Jussieu, another scientist involved in an earlier French investigation, actually refused to sign the negative report and wrote his own positive one. So the dismissal wasn't unanimous among the intellectual elite.
Given all this, what's Elliotson's final plea, his message to the medical and scientific world?
It's really a call for intellectual honesty and humility. He urges doctors to be scientific, liberal, and humane, to admit all that he finds, even if it's inconvenient or strange.
And to actually look for improvements.
Yes, instead of just sneering lazily at people who are actually trying new things, he slams those who refuse to even witness mesmerism because they had a character to lose.
Like the professor who wouldn't look through Galileo's telescope.
Exactly the same mindset. It's a powerful call to prioritize truth-seeking over protecting your reputation or sticking to dogma, a message that still resonates, I think.
Absolutely. What a journey through this document. We've seen this incredible possibility, pain-free surgery, clash head-on with disbelief, with entrenched prejudice, even with arguments that seem utterly bizarre today.
Right. The evidence was laid out case after case, yet it was dismissed, ignored, suppressed. Proponents were attacked. It really starkly illustrates how difficult progress can be.
It forces you to ask, how do we actually figure out what's true when something genuinely new comes along that just doesn't fit our existing boxes?
That's not always easy. Dogma, ego, fear of the unknown, they're powerful forces, then and now.
So maybe here's a thought to leave you with, thinking about Elliotson's sin of presumption. How often do we do that today? In our own lives, maybe.
You mean jump to conclusions about new ideas?
Yeah, or new data, new ways of thinking. How often do we form strong opinions without really digging in, without really qualifying ourselves to have that opinion, as Elliotson put it?
It's a searching question.
Are there potential breakthroughs, potential blessings, as he might say, that we're just missing right now just because they seem weird or don't fit what we think is possible?
The story of mesmerism is definitely a cautionary tale. It reminds you that sometimes the biggest block to discovery isn't that we don't know enough, it's that we refuse to be open to learning something new. That willful refusal to look through the telescope.